Being given the news that you have testicular cancer and that you are going to have a testicle removed and you may go on and have some further treatment after that is incredibly difficult. People can feel a whole range of different emotions actually. I mean, some people would say they felt completely numb, like in total shock actually, like they didn't actually feel that much. Other people would feel a roller coaster of, you know, they might feel quite down, they might feel quite angry, quite hurt, frustrated. They might feel a whole range of different emotions at that time. It's incredibly difficult news to be given, and you know, it's people will respond in a very individual way to it actually.
You just went numb, you just go into shock. Next thing I know, I'm having x-rays done and blood tests done, and I can't even remember driving home. All I remember sort of falling in through the door and saying, I've got cancer, I'm dying, which is a little bit on the dramatic side.
There was a sense of relief in one respect that we knew what it was, because up to then we didn't, and that it was at least a cancer that was very treatable, albeit that it had spread.
I think the age at which many people get diagnosed with testicular cancer, you know, means that it happens during a phase of transition actually, whether that's kind of in the late teen years or the university years or the kind of early into perhaps thinking about job or working beyond kind of university for some people. And that means that actually there's a process of kind of your health is being interrupted at a time when there's lots of other transitions going on, where there's lots of other things that people are trying to work out, which just makes it enormously complicated for people actually. And I think it's not a, hopefully young men would remember that it's not a simple thing that they're being asked to do, and that it would encourage them to perhaps seek some support during that time actually, as they're trying to juggle all these different things and all these different changes in their life.
I didn't check myself prior to getting diagnosed. I first noticed the lump sort of a couple of months prior to going to see the doctor. It was, at first it was just a small lump, so I sort of passed it off as nothing really. And then I guess I sort of tracked it as the lump got bigger over time and realised that actually it was quite a big problem.
So it's just 3 weeks after my 20th birthday, and I was studying in Australia. I was on a trip with my friends around the east coast of Australia, and unfortunately I had an accident when I was on a houseboat. I bumped into myself and I noticed that there was a problem with my testicle.
I didn't want to go and talk about personal issues such as, you know, testicles or, you know, anything to do with men's health. I didn't feel comfortable about doing it. I felt embarrassed. I certainly didn't let my girlfriend or family know. So it's one of those things that I always just thought, well, I'm invincible and it's not going to affect me.
So I had the accident on the Tuesday. I was still in pain by the time that we got off the boat on the Thursday, and I was taken to a doctor's appointment, which then led on to the ultrasound. And that Thursday, I was told that it was 60% chance that it was cancer. Friday, when I had the blood test and met with the oncologist, I was told that it was 70%. And then when I got the results of the test and was told it was cancer, was on the Saturday.
And I can remember to this day walking in to that consulting room and just the way he looked at me. And I remember there was a nurse in the room and he just sort of said, I'm sorry to say you've got cancer. That's probably one of the worst moments of my life, to go in there thinking I just had a cyst and then be told I had cancer and not knowing anything about the disease.
So the doctor told me on the Friday that I would need an operation to remove the left testicle because it had a fairly large tumour on the side of it that needed to be removed as soon as possible. At which point we also talked about what my future care would be in terms of receiving chemotherapy. The results of the CT scan effectively showed that the cancer had spread to my lungs. So through my abdomen up to my lungs, and I would be requiring a course of chemotherapy.